the impression of the partial denture patient utilizing Aquacil Ultra and the Strong Massage DENPLANT impression tray. The viscosities used here will be the rigid, light viscosity, and extra light viscosity. As seen here, we have a patient who's missing both anterior teeth and posterior teeth. Once again, we have 3 sizes of DENPLANT trays. Each of these trays are heat moldable. We want to size the tray into the mouth. If the tray doesn't fit exactly, or if it binds either on the lingual of the lower or the labiobuccal of the lower, we can spread the tray and reshape it. These are all thermoplastic trays. When you place the tray in, you want to make sure that there's enough space between the teeth and the tray. The tooth should be approximately centered to the tray, so impression material will be on the both labial, buccal, and lingual surfaces of the tooth, allowing a good impression. As seen here, we take a micro torch and we can shape any area that binds. The micro torch must be moved very rapidly, very quick strokes in that particular area that you want to reshape it. The tray will begin to turn much clearer. As it turns clear, we know it's soft. Take your finger and thumb and bend it, and then place it into cool water. As demonstrated here, I'm actually compressing the lingual area of the lower tray and then placing it into cool water so it will re-solidify. Don't place it back in the patient's mouth until you're sure it's cooled down. In this case, the posterior area of this particular patient, the ridge was slightly wider on one side than the other. Therefore, I take the flame, I heat the center of the tray, I then take and spread it, put it in cool water to re-solidify, and then retry it in the mouth. We now place it into the mouth, making sure that the tooth is centered both in the labial and lingual portions of the tray. Once we remove the tray, it is necessary to trim any excess. In this particular case, we have removed the axial heights, exposing only the occlusal and incisal edges. This gives us a great path of reinsertion. We are now putting adhesive around all borders of the tray. Once the adhesive has been placed, we can then inject the rigid polyvinyl siloxane to begin our border molding. As seen here, we have injected the material all around the tray and will now place it into the mouth and do all border molding procedures. As seen here, we have the completed border, and some of the material has gone into the areas of the teeth. These will have to be removed prior to the wash. Analyze, trim any excess, and then take a full millimeter around the entire vestibular border prior to the final wash. As seen here, I have removed a full millimeter of material around all of the vestibular border, and then I have used a burr, gone back into the tooth channel of the tray, and removed any axial heights or indentations, only leaving occlusal or incisal edges. This gives me a path of reinsertion and will let the wash material cold laminate. This is your custom tray. I will now put adhesive around any exposed areas of the tray, or anywhere I'm concerned that the material may not stick. And then I place a light viscosity polyvinyl siloxane around all borders and into the retromolar pad area. I now place an extra light viscosity PVS in the tooth channel all around. As you see here, we have a light viscosity around the borders extra light viscosity inside anywhere there are teeth. We will now inject extra light viscosity around the teeth and then place the tray into the mouth and repeat our border molding procedure. Once again, the patient must move their tongue out, side to side, and back. We must then have the patient pooch and then smile. Take our finger and thumb and border mold the external oblique ridge and the anterior frenum area. As seen here, we have our final impression. Examine the detail. Take a look at the peripheral row. Look at the thickness or thinness, basically the height and the width of the peripheral row. This is where we get our retention. Take a look at the tooth channels. Look at the integrity of the teeth. In the past, we have utilized Allergent impressions. Allergent is a very good material. However, we do not get a refined and good peripheral row. We'll get generally either an overextended or underextended peripheral row. Many times after the partial has been completed, we will reline the saddle areas. By utilizing the polyvinyl siloxane material and the thermoplastic tray, we are able to get the finest of impressions that we have in the last 40 years. It is now common that once the partial impression has been completed, relining becomes a thing of the past. You will only reline as the patient begins to resorb. This is just another angle that will show you the detail of the peripheral row, both the lingual area, the labiobuccal area, and the tooth channel.